Good morning, everybody. Thanks for joining us for our 3 News Now early update. I am Ben Axelrod, stepping in for Stephanie Haney today, and we are covering the most up-to-date coronavirus numbers within the state of Ohio, the top headlines across the world, as well as here in Northeast Ohio. And let's get right into it with yesterday's COVID-19 numbers here in the state of Ohio. Confirmed and probable cases up to 41,576 to date. That's 428 new cases, an increase of 128 from the day prior. Confirmed and probable deaths, we now have 2,573. This is 16 new reported deaths from the day prior. Hospitalizations, we have 6,948. This is 53 new hospitalizations from the day prior, and ICU admissions, 1,776. That's 14 new ICU admissions from the day prior. Speaking of COVID-19, there is a new drug in England that researchers say is bringing promising returns. Researchers in England say that they have the first evidence that a drug can improve COVID-19 survival. A cheap, widely available steroid called Dexamethasone reduced deaths by up to 1/3 in severely ill hospitalizations. Results were announced on Tuesday, and they said they will be publishing the results of all of this soon. The study is a large, strict test that randomly assigned 2,104 patients to get the drug, compared with 4,321 who only got the usual care when it comes to COVID-19. The drug was given either orally or through an IV. After 28 days, it had reduced deaths by 35% in patients who needed treatment with breathing machines, and by 20% in those who needed supplemental oxygen. It did not appear to help patients who were less ill. It only targeted those, or only helped those who were severely ill with COVID-19. One study leader said, "This is an extremely welcome result. The survival benefit is clear and large in those patients who are sick enough to require oxygen treatment. So dexamethasone should now become standard of care in these patients." Dexamethasone is inexpensive, on the shelf, and it can be used immediately to save lives worldwide. Steroid drugs reduce inflammation, which sometimes develops in COVID-19 patients as the immune system overreacts to fight the infection. The overreaction can prove fatal, so doctors have been testing steroids and other anti-inflammatory drugs in such patients. The World Health Organization advised against using steroids earlier in the course of the illness because they can slow the time until new patients clear the virus. We look forward to seeing the full results when they are available. Moving on locally, the Akron Marathon is going virtual this year. Organizers of the Akron Marathon announced that the 2020 race will be held virtually after months of conversation that determined that holding the traditional event would be too great of a risk to the runners and the citizens. The virtual race will take place from September 25th to September 26th. The related race events, including the Health and Fitness Expo and the Kids Fun Run, will also be held virtually. Organizers said in the press conference on Thursday, with every scenario explored, the Akron Marathon team and board would ask questions like, is it safe? Can we host the same top-notch experience that we always do? Are we okay with offering a different experience? Does it make financial sense? And every time an answer would come back negative. If you've already registered for the marathon, half marathon, team relay, or kids fun run, you will have the following options. Keep the registration to participate in the virtual event, donate the registration fee, or defer the entry to a future race. Organizers also said that they will be reaching out to registered runners to communicate available options. Runners who have not yet registered but would like to do so are available to do so by June 30th. Moving on, another local story. Cleveland Clinic and UH Rainbow were named 2 of the top U.S. hospitals. The health system in Cleveland has earned more national recognition thanks to a report by the U.S. News. Cleveland Clinic Children's has been ranked among the top hospitals in the nation within the following specialties: gastroenterology and GI surgery, neonatology, cardiology and heart surgery, cancer, urology, neurology and neurosurgery, orthopedics, pulmonology, nephrology, diabetes, and endocrinology. An official said in a press release, no children's hospital in Northeast Ohio ranked in more specialties than Cleveland Clinic Children's. University Rainbow Babies and Children's Hospital ranked among the nation's top 50 children's hospitals in 8 specialties, 4 of which landed in the nation's top 25, including orthopedics, pulmonology and lung surgery, diabetes and endocrinology, and cancer. The U.S. News rankings, which were revealed on Tuesday morning, were determined on multiple factors, which include patient outcomes available, clinical resources, and compliance with best practices. Chair of Cleveland Clinic Children's Dr. Karen Murray said of the rankings, "We were incredibly honored to be recognized by U.S. News and World Report. This is a reflection of the dedication, compassion, and hard work of our caregivers to provide the best high-quality care to our patients and their families." Throughout the past year, Cleveland Clinic Children's has been at the forefront of clinical innovation and research in pediatrics. Hospital highlights as detailed by hospital officials include the following: a multidisciplinary team of specialists repaired spina bifida birth defect prior to birth in a nearly 23-week-old fetus, an innovative split liver and heart transplant surgery that gave a young patient a second chance at life with the best outcome in the region. Magnetic spinal rods helped improve outcomes and quality of life for young patients with scoliosis. A groundbreaking study showed that holding off a newborn's first bath 12 hours or more after the bath after birth can improve breastfeeding rates. And a large data mining study showed that digital conversations providing a needed emotional outlet for teens and adults with epilepsy. Congratulations to the clinic, to those Cleveland hospitals. Moving on, a petition is calling for Kings Island to remove its mask requirements. When Kings Island and Cedar Point open for the 2020 season next month, all park guests will be required to wear masks. It's been a hotly debated topic that has now sparked a petition that calls for King Island to lift their mask rule. The petition says, if you choose to wear a mask, great, but don't force healthy individuals to do so. Posted on change.org, nearly 7,000 signatures have been collected as of 10:30 a.m. on Tuesday. The heat and humidity alone will make this difficult to do, the petition says. Don't force your children to do this. Stand up for our rights. Many people have paid for passes and won't get to use them now. Although Ohio Governor Mike DeWine announced that amusement parks could begin reopening on June 19th, both Kings Island and Cedar Point are waiting a bit longer. Kings Island will get things started first with a reopening date on July 2nd, while Cedar Point will later reopen a week later on July 9th. In addition to the mask requirement, both parks will have other safety precautions in place as they reopen amid the coronavirus pandemic, which include park capacity, temperature checks, social distancing protocols, including on rides, and increased cleaning. Do you think that the amusement parks should remove their mask requirements? Do you think people who disagree should just avoid those amusement parks? Let us know on social media how you feel about this topic. Thank you for joining us for our early update. The digital producer, Kiara Cotton, will be on our afternoon update at 2 p.m. today, giving you all the latest on the COVID-19 numbers from the Ohio Department of Health and the newest stories to keep you informed. Thanks for watching.